Welcome to Mendel Center Connections. I'm Grace Kelmer, and we are today going to be talking about a new initiative with Area Agency on Aging and some other partner organizations locally. And so my guest today is Peggy Schaffer from Area Agency on Aging. And Peggy, welcome. Can you tell us a little bit about yourself and the work that you do at the Area Agency on Aging?
Yeah, absolutely. Thank you, Grace, for having me. Peggy Schaffer, project manager with the care continuum at Area Agency on Aging. My husband and I have lived in this area for, over 20 years. My husband is, from this area. So it's what I love about this initiative is it's a way to give back to the community that we have been a part of for so long. So thank you for having me.
Mhm. Mike Nadolski spoke with Area Agency on Aging CEO Lynn Kellogg a few months ago just about the general services that you provide. But here you're actually talking about a new initiative that's in the works and that was just recently announced. Can you tell us a little bit about that?
This is a very exciting time with the partnership between Region 4 Area Agency on Aging and Spectrum Health Lakeland. The two partners have been working for several years, way back to even 2013. And prior to that, what they started was an interagency care team, which was designed to coordinate care and address the needs of someone, that not only their medical needs, but their social needs. So what are their needs at home? Um, and also to reduce utilization, because what we're finding is the more complex care needs someone has, or the more diagnoses or the more medications, the more barriers to taking care of themselves. So this really sprang from that care team, and it's a planning grant that we were awarded through the Michigan Health Endowment Fund. So they're a great partner in community initiatives. And what we started doing is, how do we take the great work of this interagency care team and expand it to the community? But we knew that we needed to do some community assessments. We needed to really, get a 360-degree view of what complex care looks like in our community. So we had some research to do. And so that's really where it started. And that's where I was, blessed to be able to come in. So with the planning grant, we contracted with the Alterum Institute to look at what are our utilization data in our Tri-County region. And what I mean by utilization is, with this older adult population, how often or frequently are they using the emergency room as, kind of their primary care? How many inpatient visits? And then where are they going if they're in the emergency room or inpatient? Are they being discharged home, or are they being discharged to a skilled nursing facility and then maybe eventually at home? And just looking at the cost of that care, versus if we could take care of someone in the community that they love, in the home that they love, with their family and friends, in that support system, what would that look like? So that is something that we'll be reporting out at our community convening on March 31st, some of that community data.
Mm.
And then the second part, that just to really get more of a personalized view of complex care in our community, we wanted to interview people with lived experiences. So we tried to identify all those people who would, touch a complex care older adult. So we started by interviewing complex care older adults. So we looked at those who had several diagnoses, several medications, and who had that high utilization. So they had been, in the emergency department several times over the last several months. So really, showing some instability. And so we interviewed them, one-on-one over the telephone, just to get a bigger picture of what they're facing and maybe what their needs are. And then we looked at caregivers, because caregivers, they do so much, right? And just how can we support them? What are their needs? What are the barriers to providing care for their loved ones? So we did those caregiver needs assessments. And then we looked at the medical staff that would take care of those complex care older adults when they're in the ED, when they're inpatient, when they're even in the ambulatory world. So talking to them when they go see their primary care provider, and the care plans that they design and how that translates to once they leave the office or once they leave the facility, are those care plans actually fulfilled? And then also, we along that spectrum, we talk to area agency care managers. So when someone is back in the community and you have the care plan from the hospital or from your primary care doctor, what needs do you still have in the community that area agency can take care of? And then asking those really tough questions. So if you build the care plan and someone can't fulfill the care plan, what are those barriers and how do we break down those barriers? Um, and then finally, we sent out a tri-county survey of community-based organizations. So we really wanted to know if you serve complex care older adults, or if you just serve over adults and don't know if they're complex care, what are some of the needs that you are seeing, especially with the COVID-19 pandemic? So we did, a survey that's, pre-pandemic, post-pandemic, how have the services changed? And as you can imagine, many of the services were online. A lot of the community-based organizations lost volunteers, which is really the backbone of their organizations due to the pandemic and the isolation. So, putting all of these reports together just to get that 360-degree view of what complex care looks like in our community. And so we're really excited about the results, and we're excited about reporting that out on March 31st.
That's great. So those reports were happening before this new grant that is helping fund the implementation of what you found that could be helpful. Is that basically the point you're at now?
Yeah, so this is really an exciting time for everyone involved. We are kind of sandwiched between the planning grant is ending March 31st, and then we were awarded an implementation grant through the Michigan Health Endowment Fund, which we're extremely excited to have. So what the implementation grant will be is taking all the data that we learned from the planning grant and then trying to implement that on a community-wide basis. So we will be, starting that after March 31st, and that will run for 2 years and then hopefully beyond. So we really want to look at breaking down those barriers, building community partnerships, because we know that we can't do this alone. And then hopefully building something that will endure after the 2-year grant is over.
Wow, that sounds wonderful. And this is such a great time to be thinking about. It seems like everyone is probably in some kind of complex situation at the moment, that there are new social and home concerns that everyone is going through. And I imagine it's been especially rough on our older adult population right now. So it seems really timely.
Yeah, and
Plus
isolation
the
is
additional medical
really,
concerns too. It's just on both
yeah,
sides. There's a major impact right now.
yeah. I mean, isolation with the pandemic, I mean, it's been difficult on everyone. It's especially harder on our populations that maybe are not as mobile, um, and are, yeah, they just need that extra help. So obviously, area agency and other agencies have really stepped up on, phone calls to older adults at home just to kind of check in. I know the Spectrum Health Lakeland, in their practices, there's been more telehealth visits because really just because of a pandemic, the medical needs don't go away. So we really do need to address them and reach the people where they're at. So I know that our community-based organizations have done really well in adjusting and pivoting during this pandemic. Unfortunately, the pandemic isn't over, but I think we've learned a lot that's going to help us in the future to address these needs.
Right. Yeah, it's not just COVID related. It's really something that was happening long before and something that, yeah, that your implementation is going to help indefinitely into the future, hopefully, to help chart that new course. That's great.
Yes.
So then you've mentioned March 31st a few times, and that's the date of a kickoff convening that you're hosting via Zoom. Can you tell us a little bit more about that event? Any highlights you'd like to share, and what you expect? And also, who can attend? And is this something the general public can come to, or is this for certain groups?
Okay. Yeah, so March 31st, we have partnered with the Mendel Center to provide this community convening. And it's really a report out on everything that we've learned over the last year. And then looking at trends in healthcare and, community-based services for the future. So we're super excited. We have two keynote guest speakers. One is Dr. Ira Bayak, and he is, represents kind of the medical side of this grand partnership. And he will be talking about like I said, the trends in healthcare, how providers can, pivot to help address a lot of those social needs, knowing that those social needs will affect the medical needs. And then we also have Robin Golden, and she's from Rush University and an organization called Chassis. So she'll be speaking from the community-based side. So what can communities, community organizations, faith-based organizations do to help in this effort? So to, help the medical field. So really looking at the whole person. We want this, any angle that we're looking at, we want this to be person-centered. We want the person to be in charge of their own lives and their own care, and just how we can all work together to make sure that that happens. So we'll be reporting out on, future strategies and trends that are exciting that are going on in other communities, and how we can implement that here with the community's help. And I want to stress that because we need many partners in this effort to take care of those that live in our area.
Great. So then, can anyone attend this? Is there room for older adults themselves to come and hear what that is? What's going on, or who do you recommend signs up for this event?
We we would love if older adults would or caregivers would register for the event. I think it's great information to have. I think mainly though it's for those people who would partner with us. So faith-based institutions, social service type agencies, anyone in the medical field, um, really anyone who has a stake or an interest in helping older adults and helping, the partnership continue. I think it's for funders because there is a lot of trend data that is, really exciting to look at, um, and where initiatives could branch off of this. Um, so yeah, just a community based. Oh, and then funders for healthcare. So insurance companies, we're inviting some of our contacts from that arena because there really needs to be a shift in how we look at paying for the cost of care. So not just going into your physician's office and paying for that one visit, but what about the care management? So you've built a care plan for the individual. How does that translate when they leave the office or when they leave the facility? So just yeah, presenting a lot of really groundbreaking, future trend topics.
Sure, great. And then you mentioned earlier that a lot of these community organizations have lost volunteers over the last year. Is that true for Area Agency on Aging as well, or are there other ways that people can support the agency at the moment, or in those other organizations that you're aware of, or anything else we should know right now?
Yeah, I mean, obviously, any volunteer opportunity that someone once did, it would be nice, if they would call their agency back and just see if they can re-engage. The area agency, as with many others that we interviewed, they have had to do a hard pivot on, how do we provide the services that we have provided pre-pandemic, during the pandemic. So I know that they have initiated some friendly caller programs where you can sign your loved one up or yourself up to receive, phone calls from volunteers just to check in, how are you doing? Just to have, a conversation. So obviously those are great volunteer opportunities for people.
Wonderful. Well, Peggy, thank you so much for spending some time with me today. Any other closing thoughts before we sign off?
No, we appreciate all the community support. We appreciate the partnership that we have with Area Agency and Spectrum Health Lakeland, and appreciate you, Grace, in helping us set up the event for March 31st. So thank you.
Thank you. Yep. And I'm so excited to hear more about what this care continuum looks like and will do for our community and the people in it. So Thank you.
Thank you very much.